Dr. Appleton here. So, coming in live, wanted to bring you all on a journey. I have a presentation that I have to give to Black Nurses Week. It's their virtual monthly meetup, and they have selected me to speak about racial disparities in healthcare. So, that's what we will go ahead and get started. So, let me turn my microphone on. Hello, good evening.
Hi, Dr. Appleton. How are you?
I'm well, and yourself?
I am well. Let's see if I can get this right. Today I'm running so far behind, but
I understand.
Something went over at work and I was like, oh no, I got to hurry up and get back.
Right. I got things to do.
I was texting people in the meeting. I was like, I got to go. I can't stay. I mean, y'all have to send me notes or something.
Send me the notes. Exactly. So I'm also on live on TikTok. I know you saw the video. So I'll be also on TikTok live giving this presentation. And also hopefully bring some more members in, because I know there's quite a few nurses that follow me. I don't know if they are part of your organization. So kind of doing a cross promotion thing right now as well.
Okay. Are they able to hear us as well?
Yes. Is that okay?
Have you already went live on TikTok?
Yes.
Okay. Already went live on TikTok?
Yes.
Okay. That's fine.
I know. I was keeping it. I had to give the little disclaimer. Welcome in, everybody.
Hey, Alex. Hi.
Hello.
How are you?
I'm well.
Good.
So do we want to give it a few minutes? I do have like a small presentation. And then there's a portion for Q&A. And then I also like to always do, when I do like these smaller mini sessions, I always have a survey at the end, because it's all about the statistics and, creating space for advancement in healthcare. What do our people need within healthcare? So I'm all about that as well.
Yep. Sounds good. Give people a few minutes. Let's see.
How do I share screen on here?
At the minutes. Let's see.
How do I share screen on here?
At the bottom.
Okay, I see it. I found it.
Okay.
Can you see my screen is the question.
Yeah. Yeah.
Perfect. Okay, so we'll get started in just a bit. So just know I'm not able to see y'all. I don't know what. Let me see. Maybe if I do this. If I present it in presenter view, maybe. No, because that's not going to give me.
I can see your presentation and I can see us.
Okay.
For you, I'm not sure on your end.
Yeah, I'm trying to see how. Open. I got it here. So this is what I'll do. I'll present. I'll put it in presentation mode, and then there's a portion at the end for questions. So as long as you can see me, we're good.
Okay.
But I don't want to do it like that. Present, and we'll do it full screen. All right, perfect. So yeah, so then this way, as they come in, they'll be able to see me. All right. And so pretty much you'll just let me know when to start, because I can't see y'all. All I can see is my presentation.
Okay. Okay. So Alex, I'm used to Alex, so she know who I am.
Okay.
So you can go ahead and you can get started. I won't do an introduction. I was going to introduce you, but I'm pretty sure it's in their presentation already.
Yeah, you do enough of these, it becomes, and that's my favorite part. My favorite part is the introduction. So if you do want me to get started, I can. And as people come in, we'll I know we have a good amount of time allotted, so I want to be able to say, okay, I can go back or I can answer questions. I did leave a good portion for Q&A because I anticipate that there will be some questions. And so that is always my favorite part.
Sure. Just because you said they can also hear us on TikTok as well, right?
Yes.
Okay, so I'll just start. I'm Tequila Manning. I'm the founder of Black Nurses Week, and we host a monthly virtual meetup for we create a space for the Black nurses so we can have the conversations that most Black nurses may not be comfortable with having. So I created this space on a monthly basis so we can come in and talk about the things that we experience in our workplace. How to address those issues and challenges. So this is what I call a safe space for us. And so for this month, I came across Dr. Appleton on social media, and I wanted to invite her to speak to the community on this specific topic of racial disparities in healthcare, just based on her background, her education, and all the work that she has done in these spaces and research. So I'll pass it over to you, Dr. Appleton, and you can take it away.
All right. So welcome. Thank you for having me. I greatly appreciate the opportunity in every capacity, especially when it comes to speaking to healthcare professionals that look like me. I love that for me. I love that for us, that we are creating these spaces. Thank you for creating a safe space for healthcare professionals, because we know as the minority in a lot of healthcare spaces, it's definitely hard to get our voices heard. And so that is what my research is dedicated to. So I'll hop right into it. Welcome to Racial Disparities in Healthcare. I'm Dr. Appleton, and I'll get right into it. So I always like to start with who is Dr. Appleton. I'm a multi-healthcare professional in the allied health. So I am a phlebotomist as well as an optician and a healthcare business owner. So Top Notch Eyewear is my business. And then I'm a researcher and an author. So I have a few books that I've published because of my research. My number one book right now is Nevertheless She Breastfed Despite Racial and Cultural Disparities, where I talk about the experiences as a Black woman and a healthcare professional who advanced in education and saw the changes and how to better advocate for myself in healthcare spaces. I'm also a professor and curriculum developer, so putting together events where there's safe spaces, where there's information that can be delivered in a digestible way for our community, especially one where we can, get into a space where we find the ability to get our questions answered. A lot of times I'm noticing healthcare professionals and consumers alike are having a hard time getting their questions answered when they're not being delivered by people that look like them, that look like us. So I always like to do a little game, if you will. And so I have this question that I always pose. Is it a racial disparity or an implicit bias? And so the question is, a hiring manager favoring candidates of a certain race without conscious awareness. Is it a racial disparity or an implicit bias? Is it a racial disparity or implicit bias? Tequila, you would have to tell me what the answers are in the chat, because I kind of had it set up in my mind that I would have people answer in the chat, but I can't see the chat right now.
I got you.
So a hiring manager favoring candidates of a certain race without conscious awareness. Is it a racial disparity or implicit bias?
One response is implicit bias.
Yes. Implicit bias it is. And y'all can play along over on TikTok over here too now. We on live. So I always like to break down the definition. I always want to start with the definition. I'm going to kind of glaze over it. Not because it's not important, the definition, but most of us know what healthcare is, right? As healthcare professionals. The reality is when it comes to a racial disparity, I think that's kind of where we lose, where the gray area in the definition happens. And so that's why I like to distinct what is a racial disparity over an implicit bias. And I gave y'all an easy one. Next time I'll give a harder one. But a racial disparity, so I like to tap into the area that is racial. So racial, we know, is how socially we separate who is who, right? Divided based on their physical characteristics, ancestry, and things like that. Cultural, that would be in the racial aspect of it. But a disparity is a difference in a level of treatment, especially one that is seen as unfair. And then, as healthcare professionals, our goal is to restore, promote someone's social, mental, emotional well-being. Often we're licensed and trained professionals, certified professionals, but we are in the space of delivering healthcare, right? But let's harp in real quick on the disparity part. A difference in a level of treatment, especially one that is seen as unfair. So now I've come up through my research with a more cohesive definition based on those three, and based on that, it's like, okay, someone who anticipates that they're going to receive good treatment, but then they receive lesser than quality treatment, because we know we want to receive quality healthcare, not just healthcare, but quality healthcare, but they're receiving lesser than quality healthcare because of their race. That is the cohesive definition that I've come up with through my research. Pretty much an implicit bias goes back to that question that I posed. It is implicit bias refers to unconscious attitudes and beliefs about certain social groups that influence understanding, actions, and decisions, and even if the individual is unaware of their own biases. And I like to use the one where in my own personal experience, I've had it where I've had even patients turn me away because of my race, so we're gonna get into that, because I know that's like a alluring question, like how do you handle that? So we'll get into that. But I often like to point out, when we're talking implicit bias, sometimes implicit bias can be within your same race. So black nurses to black nurses, or black nurses to black patients, right? Or we see it more so within our own community. That would be an implicit bias. But then when we are the patients, as we are the patients, and we're black, and we can see, oh, well, they're just saying this certain thing about me, right? Maybe it's not necessarily my race. Sometimes the implicit bias could be because of weight disparity, or because of gender disparity, or because of poverty disparity, or income disparity. So those different disparities all tailor into the racial disparity that creates what we see within our healthcare, and how healthcare is received, and how it's delivered to us as well. So something that I like to always share articles, because I say healthcare is collaborative, but not only is healthcare is collaborative, when we have access to research. And sometimes if you're a nurse, I know there's different levels to being a nurse. If you don't further in the nursing career, like myself, I have a doctorate in health science. I'm not a nurse, but I've had nurses within the program with me who I still talk to this day. They got their doctorate in health science, so they understand what goes into the research, right? Sometimes as a nurse, you're so focused on delivering the care that you may not understand what goes into the delivery of research. So I always like to let you know that I'm going to share articles, and you can screenshot them and go back and read them at your leisure. But this article from the New England Journal of Medicine, I wanted to take a moment to talk about implicit bias in clinical judgment and representation in health research. And so this article pretty much went into the fact that some implicit bias does take precedence in clinical research in the way that we see how healthcare is delivered. So in medicine bias driven by discriminatory practices and policies, not only negatively affect patients' care and medical training environment, but also limit the diversity of the healthcare workforce, which leads to inequitable distribution of research funding and hinder career advancement. And so that looks like, a nurse, a charge nurse, maybe, a nurse who has gotten her doctorate in health science, or a nurse who has her MSN, or she went and got other higher degrees, the DNP, but they didn't select her because of her race, because there's a lack of representation in that particular organization. But we can also see sometimes, how does that show up in research? It shows up in research because we have to go back. What was the history of research when we were saying, okay, this is the type of iron you should have. These are the markers you should have. Black people weren't included in that. I mean, no minorities were included in that, if we're being honest, right? So even, I like to use myself as an example, somebody who has neutropenia, just abnormally low white blood count. It wasn't until I went to a research hospital and they said, to be quite honest with you, there's nothing wrong. That's just your normal. And I was okay with that because I had no signs, no symptoms, and fully functioning. Everything was fully functioning and well. I went even as far as to see a integrative medicine doctor because of it. So when we look at, how does this show up in research, we find that, race plays into that, sexism plays into that, systemic biases plays into that, systemic racism, cultural, social. There's a whole lot of other issues that play into why we don't see the representation in healthcare research and how bias plays into the clinical judgment, right? So bias plays into clinical judgment because we still see it, because I've had some students in my time as a professor who I've helped them get into medical school. And they're in medical school now. I'm no longer their professor. And they're texting me. They're like, hey, Dr. Appleton, what you said in minority health was true. What you said in legal aspects of healthcare is true. And what is true? It's true that there are still some medical textbooks and some medical teachings that don't align with what we know to be true. That maybe in some of these cultural classes, because I even came across that in my research and studies, that culturally certain demographics are going to ask for more pain medicine than others. That we know that to not be true, as we are the healthcare professionals who are feet on the ground and seeing patients first. So one of the things that Miss Tequila Manning had let me know about was that there was a question about the lack of diversity and representation in emergency rooms. So y'all know I had to pull out my research bag. I had to put on my research cap. And I decided to pull some research. I'm big into numbers. I love the numbers. And I also wanted to share this article with y'all. I was like, if they like research like me, they're going to like this article. So here's the article. It's called Increasing Representation of Primary Care Physicians, a Critical Strategy to Advance Racial Equity. And so I didn't find one specific to nurses, but I did find one demographic in the National Health Institute. It was a full study about Black representation in the ER. And in short summary, before I get into the details of it, in short summary, I saw a video, y'all could check on TikTok. I put it in my repost. A Black physician woman saying that, it's funny how I saw it today and I just was going to speak with y'all this evening, is that when Black healthcare professionals, she said Black doctors, but I'm going to paraphrase it and say Black healthcare professionals. When Black healthcare professionals show up, patients live longer. And I found the article that points to that. So despite the importance of racial diversity gaps at all levels of training and leadership, in 2019, approximately only 4% of emergency medicine residents, approximately only 4% of emergency medicine residents were Black. And 8%, I think I cut it off here by mistake, but 8% are Hispanic. So, and that's not even talking generally about nurses, but I was like, oh, there is a big lack in the ER. And I didn't know that was something that is, that affects nurses. So in particular, I should say. So I really want to look more into this because it really leads me to think if we are not, hospitals have a due diligence. I'm teaching a course right now called Healthcare is Politics, where I talk about EMTALA, which is the act that emergency rooms have that they can't turn patients away. The reality is sometimes they're not seeing their people and they're still probably getting turned away, right? There could be a little bit more empathy. We see that healthcare is leaning more away from empathy and just get the patient in and out. And so I think that is happening because of the lack of representation. And I could be wrong, but leading into the research of it, there could be more empathy when we are in the spaces to help the patients that look like us, right? And so they found that there was an increase. This is the crazy part about this article. They found that there was an increase of 10% increase of Black representation is associated with 30.61 day increase of life expectancy. And so I told y'all a little bit about my book that I wrote, but my research is maternal child topics. So my bachelor's is in health science, where I concentrated in maternal child topics. My master's is in health science, where I concentrated in higher education. And my doctorate being in health science, I concentrated in global health. And when I concentrated in global health, it was because of all of things that I learned in my master's in the U.S. healthcare system. I was like, there has to be something bigger than us in the U.S. And so it led me to start looking into the global health system and maternal child topics. And because the United States is supposed to be the most developed country, I wanted to look at why is it that we have the highest maternal mortality, right? And the question was posed. I pretty much defended my dissertation to say all health begins with the Black woman. And ultimately they made me change to all health begins with the ethnic woman. But the reality is when I published it, all health begins with the Black woman, because at the end of the day, we are the ones who are going to have that empathy in the emergency room or in the hospitals. Because I was also a phlebotomist too. We are the ones that are going to have the empathy in the hospitals, as the doctor. Even as the patient, sometimes we have empathy and understand like, hey, we need a little bit more. Even if we have the education, we see nurses, doctors, other healthcare professionals, even during childbirth, are passing away due to, it's not lack of resources, because this is the United States, but it's because of lack of understanding. It's because of the racial disparities. It's because of the implicit biases that have been put in place, that Black women or somebody who's Black can handle more pain than somebody who's not. And it's those implicit biases that create a racial disparity. Not always a racial disparity is because of an implicit bias, but an implicit bias can definitely cause a racial disparity. And so I thought that statistic was one to share with y'all from this article specifically, because again, an increase of Black representation, which also is a question later on that I may address, an increase in representation, we see that that's associated with Black individuals living longer. That correlation to me is not a shocking statistic, but the reality is it's a shocking statistic. Any questions so far?
The information is good for sure. I like I may have to get the links from you on the article to send out to the community so they can click on those links and go read some of those articles.
Okay, sounds good. Yes, most definitely. So then personal experience with racial disparities and access to care. I wanted to take some time. I just highlighted some things that I wanted to not miss in this conversation is the importance of speaking up for equity, strategies for advocacy in clinical settings, navigating potential and job security and professional relationships, and resources for systems for advocacy and support. So I'm going to start with resources for system and advocacy for support. Support Black Nurses Week. Support Black Nurses Week. I know they have a conference coming up. Definitely check them out on LinkedIn. Check them out here on TikTok. And I believe y'all on Instagram too. I'm talking to my community as well.
Yes, on Instagram, TikTok, LinkedIn, and Threads. Yes.
Okay. Because that is the biggest thing. Even when I talk to younger healthcare professionals, they jump in the water, and they jump in the deep end with no floats. And the biggest thing that I can tell them is get with your community. Who in your community has something with Black in the name? Get with that, okay? There's so many different communities there's so many different communities when we're talking about what we do as healthcare professionals. And even with Black Nurses Week, and those who are a part of it, look into public health associations as well. Wherever you are, right? We have here, I'm in Florida, so we have the Florida Public Health Association, but then we have the American Public Health Association. And the reason why I plug those in is because sometimes as a nurse, you don't understand, or you may not have the information to what's going on in public health that is also going to affect your job, which leads me to my next point, navigating potential risk to job security and professional relationships. For me, I'm in between contracts and business deals. I like to let people know that because as a professor, my contract ended, and then I saw a shift in the healthcare system as well as in education as it related to what's going on in the government, which led me to teach a class called Healthcare is Politics, because at the university level, I created a course called Legal Aspects of Healthcare. And so those professional relationships, when you are part of associations, tying those two together, when you are part of associations that advocate for what you do as a healthcare professional in your specific field, you kind of get insight into what's going to happen next. So last year, I knew this year it was going to not look the outlook as it relates to research. And I don't know if any of you are up on, what's going on in the government and research and things like that. But a lot of government funding from the National Health Institute got pulled because they put out banned words. And I don't know if you know, some of the banned words is racial disparities, equity, health equity, access, breastfeeding. A lot of the words that I use over the course of my research. I have a meeting later on this month with the American Cancer Research Society because one of the researches that I was on, and I did finish it, but that particular research, they were looking to renew it, and they're having some struggles with renewing it because funds are being pulled from these different avenues of research. So again, when you are a part of a support system like Black Nurses Week or any of the other ones that I've mentioned, or Black Health Connect is another one. I always, be a part of some of the bigger ones. A lot of them are free to join, so this way you're at least on the email list. But you want to ensure that you are a part of the ones that have Black in them, because that's going to get you the information about things that affects not only you as a Black healthcare professional, right? But as a healthcare professional in general. And we know being a healthcare professional, being a Black healthcare professional, it's two different things. But I love being Black. But being a Black healthcare professional has so much distinction to me, and it holds so true to me because I'm Black. And a woman, Black woman, okay? Getting into the strategies of advocacy in clinical care. It's a gray area. It is a gray area. In the full course that is Racial Disparities in Healthcare, I share a template of how you can go about doing certain types of proposals for effective advocacy within a healthcare setting. I often say if it's some place where you're comfortable and you have pull and you have rank, do it. If it's somewhere where you don't have pull and you don't have rank, halt it. Because again, you want to keep your job, right? You don't want to be that person, but you also want to advocate for your patients safely. And I often have said, when you can identify what the mistreatment is of a patient, speak up for that patient, notate it if you can safely. Let the patient know what they can do. I just recently added to my website because I've been getting a lot of calls of people saying, hey, people who've taken the courses before, they're like, hey, what question can I ask my doctor? I'm trying to figure this out. So I was like, oh, let me put together a list of questions for every area of your healthcare that you can ask your doctor. Because sometimes I think, we get to the end of the appointment and the doctor's like, any questions? And it's like, no. And as a healthcare professional, before I had my doctorate, before I had my master's, I'm going to just say with my bachelor's, I worked as an optician and I worked as a phlebotomist. And I would go I was a bedside phlebotomist. I go into the room, I draw the blood, the doctor's talking to the patients, blah, blah, blah. And as the doctor just is exiting the room, here's the patient asking me, oh, I should have asked them this. And so I'm going back to rush to find the doctor, and the doctor's already gone. Y'all nurses, y'all know how that go. I go to find the doctor's already gone. So now I have to find the nurse. And the nurse is like, oh, well, I'll let the doctor know. And sometimes as a phlebotomist, it used to linger in my mind and be like, oh, did they ever answer that patient's question? And when you're a bedside phlebotomist, of course, you're going to see the patient again if they're not discharged. And here's the patient being like, oh, yeah, they didn't answer my question. And so, with nurses, there's more pull, there's more rank than a phlebotomist. So use that to your advantage. Notate those things in the chart. I would say follow up behind the doctor without stepping on toes, because I know that's a thing in the hospital, without stepping on toes, and say, hey, do you feel like all of your questions were answered? Because again, now when it's time for them to ask come back and see that patient, now that patient could probably give that patient a little notepad, have them write down, hey, this is what I need to ask. What did that look like for me as an optician? A patient might have been told they have a diabetic retinopathy and they need to see an ophthalmologist. They coming out to look for glasses with me and they're like, oh, he said I have diabetic retinopathy. What is that? Okay, we're in a smaller setting because it's a one-to-one type setting. Okay, let me take you back here to the doctor. Hey, doc, patient so and so has a question. Can you explain to them in better detail or in greater detail, or can you explain to them a different way, because they was asking me what's diabetic retinopathy, and I know you would be the one to do that. So really making it a more seamless, finding a way. I know in hospital settings it can be a little all over the place, or a lot all over the place if it's like how I remember it. But being able to find a way to streamline that continuum of care when it comes down to advocating for patients and making sure patients get their questions answered. The important, and that goes into the importance of speaking up for equity. If you see the mistreatment of a patient, however the protocol is, and I always say check the protocol first to see what that looks like, because yes, there's an oath for all of us, even if you're not an MD, is to do no harm to the patient. We learn that in ethics. We all have taken ethics. So you want to first do no harm to the patient, but how do I do that in my workplace without losing my job, is going to be key, is that gray area that we want to be able to navigate. So advocating for equity without retaliation. Again, if you can do so safely. But here's some things that I want to share with you. And I've shared this. This is actually an action plan that I've shared with organizations, other organizations. So it's a great one to have. The strategy would be education. Attending those bias and equity trainings. The people who typically are key in doing that, again, I'm just being privy to Nurses Week, so we'll learn along the way what other services and courses and things like that you provide that I can share out with other nurses, other Black nurses. But a lot of the public health associations harp very big into bias and equity trainings, because what public health does is ensure the health of the public, right? They deal a lot in research. Like for me, one of the events, conferences that I spoke at, I did communication for healthcare professionals, and I broke down how to effectively communicate with healthcare professionals, how healthcare professionals can effectively communicate with patients. And I kind of used the example that I gave y'all in the previous slide about streamlining the process of information for the patients. Whether it's, we see evolution of things in technology like my chart and different things in Epic and different other things like that. But a lot of times we don't know if the patient truly understands. So asking those open-ended questions, and then I'm also have the training where I do it the opposite way, where I have patients how to communicate effectively with their healthcare professional, and it's teaching them how to be better at asking open-ended questions and really getting to a space where if they're not satisfied with the answer, not necessarily satisfied with the answer, but if they don't feel like the answer makes sense to them, ask for it to be explained in a simpler way. Okay. Representation, hiring more people of color, being a part of organizations like this, right? Community engagement. I know nurses can be busy. I know healthcare professionals across the board are probably burnt out. Hence why I also do burnout prevention for healthcare professionals. But be engaged in the community. Be engaged in the community, but also knowing what community organizations align with your professional development goals, what aligns with your strategic plan, or what you want to get out there, or how you want to show up as a healthcare professional. Access, so mobile clinics, free screenings. Don't be shy to go, be a part of any of the free screening events that are happening, and volunteer that time and interact with those people. And you never know how you can impart a certain level of information into them as well. Be inclusive in research. Again, at the end of this, I will have a survey. The survey is one that I deliver every time I do any of these types of talks specific to racial disparities. I actually made a new one, and I want only Black nurses input, because again, research is for the advancement of healthcare. And how do we do that? By doing things like this. More inclusive research. So recruiting diverse participants. If you are a part of any clinical research, and you have any pull to speak up as a senior clinical researcher, speak up on that aspect and say, hey, we need more representation. Yes, we have the people who meet the requirements, but the people who meet the requirements aren't necessarily the people who this is going to affect. And that's, when you're on the research side. And policy advocacy. if you are a part of any other organizations that lobby, I know a lot of times I myself, I want to sit on the board of opticianry, but it takes so much time. And so I might not be walking the walk when it comes to that, but I am in the space when it comes to policy advocacy. I'm all about teaching other people how to effectively change policy. I'm definitely on the track with that. I just haven't sat on any of the boards yet like I would like to because of time. But showing up to those meetings, right? Whatever nursing board or unions, I know nurses sometimes have unions and things like that. Be a part of those, even if you're not on the board. Sit in on those meetings, see what's happening so you know what's going to take place next. Because a lot of times it's what happens in those meetings that we can't attend is where decisions are made. And so create solutions would be, I think this might be my closing. But creating solutions, I always like to leave you with a call to action. Definitely screenshot this. It goes back into what I said in the previous slide, how to advocate. But overall, because not only are we healthcare professionals, we're all healthcare consumers. And I think when we get to a state of mind to say, hey, not only do I deliver healthcare, but I receive healthcare is the best way to think about it. And I say that not loosely because I have come across some people who are healthcare professionals and I've had to say to them, hey, but what if it was you? And they're like, oh, well, no, but what if it was you? And it's funny how the tables turn. They turn very quickly when they do. Right. So educate yourself. Commit to continuous learning about racial disparities in healthcare and their impact to patient care, just like you're doing here right now. Advocate for change, which we talked about, being able to use your voice in those settings, being able to use your voice in policy discussions, being a part of organizations, engaging in research. And there's a variety of ways you can engage in research, even if it's like for me, when I was completing my doctorate, I had to create a committee for my research. And on the research committee, I had a bachelor. She had a bachelor's of health science in clinical research. I had two nurses. One was, because my doctoral dissertation was one of the global nature, she was a BSN RN out of Antigua, the U.S. Virgin Islands. The British Virgin Islands, the West Indies. And then I had a nurse out of California who she worked specifically in pediatric nursing because I was talking about children and maternal mortality and infant mortality. So she was a BSN RN. And then I had another DHSC like myself. She's a doctor of health science, but she also worked with in the capacity that is children and children education. So you can contribute to research. If you know any of your friends or any coworkers that's doing a master's or they doing a doctorate, always get into a space of, so where you at in your research? Because you can also contribute to that research. And most people who do their research capstones or their practicum, they tend to get that published. And then now you have contributed to that research in some way. Participate in trainings by attending workshops and courses focused on bias reduction and advocacy strategies. And definitely without, education is key. And whatever you take, you want to be able to use use it so you don't lose it. So here's some information. We can connect. You can hit me up over on LinkedIn. And I didn't put the TikTok link there. It wasn't letting me put my TikTok link. But the TikTok is Black Girl Say Something or Top Notch Eyewear. But I'm definitely on LinkedIn. This full course is available at topnotcheyes.com. Under the tab at the bottom, it says even more top notch. And here's the QR code to the survey. So you can either scan the QR code, screenshot it and screenshot it and click it, or screenshot it and click the link. So there's that for you. And what I'm going to do is also copy the link. So this way I can, I'll copy the link and share it in the chat. Oh, we got an audience. Welcome everybody. Any questions? I'm going to put some stuff in the chat, so I'll be right back if y'all could do this survey for me. And I promise I don't spam you with any emails or anything. It's simply just to add to the research when I do a future talk and I can say, hey, I surveyed a room of how many ever nurses and this is what they say they need. Any questions?
Thank you, Dr. Appleton. If you all have questions, you can raise your hand or you can come off of mute, and you can ask your questions so they could be addressed by Dr. Appleton.
I'm gonna get off TikTok live real quick because I want to be able to. So y'all, we're gonna go ahead and have